I'm Dr. Vanita Rattan from the Hyperpigmentation Clinic. I'm a doctor, but I'm also a cosmetic formulator specifically for skin of colour. So a lot of you watched my assumptions video and I talked about my own Botox and fillers, and you asked me about Botox and fillers, what's safe, what we should potentially not do, what are the side effects, etc. So I thought, you know what we should do? We should go to the source. So Dr. Zoya from Trick One does all my Botox and fillers. So she kindly said she would come on this channel to answer your questions. So what I did on our Instagram, I actually posted a photo of Dr. Zoya and asked you your questions. I literally printed out the full list, so I'll be going through them now for you. If that sounds good, please give me a thumbs up. Okay, so we do have a little bit of construction going on outside, so if you hear a bit of banging, that's what's going on. And Trick One have actually just renovated their whole premises, and I will be sending you photos of that too. Right, so let's start off from the beginning. First of all, what are fillers and how are they different to Botox?
So Botox and fillers are completely different. So let's talk about fillers first. Yeah. So there are multiple different types of fillers out there. Some are permanent, some are semi-permanent, and some are temporary. So the temporary ones are the ones that you want to be using because they've got the most research base behind them and the most evidence that they work and are safe for you. The other thing that makes them really good is that obviously there are complications that can happen, and temporary fillers are reversible. So the most commonly used temporary fillers are hyaluronic acid. So hyaluronic acid is something that we find naturally in our own bodies. It's mostly in our eyes, our joints, our skin. It's what gives us that really lovely hydration in our skin because it attracts so much water.
Everyone knows hyaluronic acid watching because you all know they're humectants and they are water magnets. So everybody watches Dr. V's channel knows about hyaluronic acid. So carry on.
Well, this is synthetically made in a lab. And it's combined with a bit of lidocaine for sort of pain purposes.
Yeah.
And essentially what happens is you place the filler in certain areas of the face to rejuvenate, add volume, add structure. But what it also does is it actually really helps the skin because it stimulates collagen in the area too.
And we all like to stimulate collagen, don't we?
Yes, we do. So in terms of how it's different to Botox is a completely different chemical. So botulinum toxin A is essentially what we use to help relax fine lines and wrinkles in certain areas of the face. And it works by inhibiting certain receptors in our muscles to reduce or completely eradicate the muscle movement. And that then reduces the lines. So fillers are essentially plumping and Botox is essentially relaxing muscle, and by relaxing the muscle you're getting smoothness in the skin.
Perfect, okay. So what we're going to do in today's video is focus really on fillers. I'm going to do a second video for you just on Botox because we actually had lots of questions for both. So moving on to the next question is, when should people start using fillers and which areas of the face do people tend to come in first for fillers?
So the areas that people come in first for fillers completely reflects our anatomical aging. So there was a paper published in 2012 that really looked at the skeletal structure of our face and how it ages over time. And the main area that ages first is our maxilla, or this area here, our cheeks. So this is where the bone starts resorbing the quickest. There are other areas as well, so like what we call our pre-jowl area. And there are some areas that just don't actually change that much. So the first area being this maxillary area or the mid-cheek area, because that loses a skeletal mass, so bone mass, what then happens is the skin in this area doesn't have as much to anchor over. So then it starts kind of falling down that way. So that's when people start noticing the nasolabial folds.
That's my biggest issue.
That even affects the tear trough area because obviously it's pulling down. So the vector of the face goes more from like a straight angle to looking a little bit more downward facing. So that's what people start saying. People, when they come in, they don't always say what it is that's bothering them.
Yeah.
And when you point out that this is, the first bit that ages in most people, it always sort of, gives a really good result when you target that area. So that's the area that we target the most.
I totally agree. That's one of the first things I did as well. I think I spoke a little bit after I had both my kids. Definitely I lost a lot of weight in my face. I felt like I lost a lot of fat in this area. and actually just filling this area did help, almost like a tenting effect.
Yeah.
It's like literally tenting your skin so that you don't have these lines, although
but these areas can go so wrong too though, right? Like, you know, sometimes I see people and, you know, they've just got these giant balls and they've just put so much filler in these areas, where actually it's not about putting so much into certain areas, it's about putting small amounts in to just replenish the lost volume. If you're trying to change the way you look by adding more contour, for example, or, you know, you can do rhinoplasties as well non-surgically. There's so many different things that you can do. That's separate. But if you're looking for rejuvenation and maintenance, just from an aging perspective, then you've got to really keep it natural and keep it simple, because you don't want to change the way you look. You just want to maintain.
Yeah, no, totally agree with you. Right, so the next question is, are there any side effects with fillers, and are there anything that people should consider before you get fillers?
Yeah, definitely. I mean, you should there's so many things. I can't so long because in my mind just went. I was like, oh my gosh, I wanted to word vomit. So, I mean, there's lots of things that they should be concerned with. I mean, if they're going to a good, reputable place, and then, you know, they have a good conversation with their doctor, they will go through all of these issues. I mean, that's just the process of consent anyway. So they should know absolutely every, you know, from bruising and swelling all the way to, unfortunately, risks being blindness. So let's talk about the basic stuff first. So bruising and swelling can happen because obviously, you know, we're injecting into the face. So it should never be, you know, more than a small bruise here or there, and it should most commonly disappear within a few days.
Where does that mainly happen? Is that under the eye area, or where are the main places?
So no, not the eye. It's mainly in the lips, because lips are just so highly vascular. So yeah, that's the main area, and it's you know, most of the time you don't, but if you do, that's probably the area that I would say I see it the most. And it's small. It's not like, you know, you've been punched in the mouth or anything like that. It's actually quite relaxed. It's not too bad. But in terms of swelling, you get the most swelling in the lip area too. I always say to people immediately after whatever they see, imagine it a good 30% less. And then the next day it's even bigger, so I just say just enjoy it, put some lip liner over it, and you know, pretend you've got these giant lips for the day. And then it just settles down, and it takes about 2 weeks for everything to calm down. Swelling, bruising, there are other issues that can happen. Just, you know, the swelling can last a bit longer in certain areas, like especially under the eye. It can last up to 4 weeks. I actually did a research paper looking into or assessing a group of patients, looking at how long it takes for people's under eye treatment with a cannula, which is a blunt-ended tube, to fully settle down, and the average we found was between 3 and 4 weeks actually.
So would people know the next day that you've had filler, or how long will it take before people are not going to think that you've done any work to your face?
I would say the general rule would be give it 2 weeks. Most commonly though, I'd say 90% of the time, in my patient population at least, the next day, 2-3 days later, they shouldn't really be able to tell that they've done anything. Okay,
so basically do it on Friday, and you're back to work on Monday.
Friday's our busiest day.
I'm sure.
Yeah, and I haven't taken a Friday off in
really?
years. Yeah, Friday's our busiest day just because people have the weekend to settle, but honestly, most of the time, it shouldn't even be that bad.
In terms of makeup, when can people wear makeup after their fillers?
So, anytime you're making any sort of insertion into the face or exposing the skin, anything underneath the skin, you want to make sure that infection control is followed. So we say about 4 to 5 hours. The longer you can leave it, the better. But you know, sometimes people come in the morning and in the evening they're going out, and it's like, okay, well, that's pushing it. But you know, 4 to 5 hours, I would say, is the minimum. But if you can leave it longer,
the next day, probably. Okay, so the next question we get asked a lot about is blindness. Can fillers lead to blindness?
So the short answer to that is yes, but the longer answer to that would be that it's very rare. Probably, you know, globally, there's been many papers that have tried to establish the statistic on how often it happens, but it's difficult because, especially in the UK, fillers aren't regulated. Who does filler treatments isn't regulated, so anyone can pick up a syringe and just inject people. So you know, you can buy them off eBay. It's actually quite crazy. So it's really frightening. You know, you can get a Groupon and go to someone's garage and you know, get it for like £50, and then they end up here with complications. Anyway, so because fillers are unregulated as such and everyone can do them, people don't have to report if these complications then do occur, including blindness. So we don't have a solid statistic on how often it happens. But there are many ways of preventing this from happening. So one of them is using really good evidence-based techniques, knowing your anatomy really, really well. Even if you know your anatomy really well, there are variations. So, you could know that, 99% of the time, one of the arteries follows this route, but actually in some people it doesn't. So you've got to be aware of the variations in anatomy too. You've also got to make sure that you're going to someone that's got a lot of experience in treating certain areas. I know one of the questions was about, what's the most dangerous area to inject that can cause blindness. And according to these papers, every area in the face has a risk. But the highest risk area would be your nose area. But, touch wood, we've never seen it in our clinic, it happening. But again, it's because you're using the correct products, you're using the correct techniques. And also, you just want to go to someone that if something like that were to happen, they know what to do. They're not going to panic in that situation. They know they have a protocol, they can deal with it. And, it's just feeling that security as a patient that you're going somewhere where, okay, fine, this is a very rare complication, but they're going to do absolutely everything in their power to prevent it from happening.
So at what point would you start being concerned and then potentially dissolving the hyaluronic acid? How would it work?
So it's a vascular occlusion, so you're essentially blocking off an artery. So it's like having a heart attack but in your face. So people would feel pain, that would be one of the first symptoms, and there are other symptoms that we look out for. So when you're injecting, you're looking at how the result is looking artistically, but also you're looking at any signs for any sort of ischemia or oxygen not being in that area. And there are other signs like pale skin, pain. So you're looking for lots of different things, and you would know that immediately from seeing it, and then you would stop and you would just dissolve. But before you get there, you're doing so many things, like you're picking the correct product, the correct gauge of needle, you're picking the correct anatomical landmark. Some areas, there's still debate about something called aspirating, where you're trying to check if blood is withdrawn or comes into the
I've heard people having different opinions on aspiration. What do you think?
Yes, I mean, there's lots of different opinions. So the latest data shows that aspiration doesn't make much of a difference. If anything, more novice injectors, when they try and aspirate, they may move off the landmark that they're trying to aim for. So if anything, maybe it's causing more risk. But I think it's, right now there's no solid data on it. They're trying to get there. There's lots of studies underway. So essentially, I think it's more user dependent.
Yeah. Okay. Interesting. Right. Next question. Do fillers stretch the skin?
That's such a common question. I mean, I think I get that at least once a clinic. So the first thing to know is that, as we spoke, hyaluronic acid is something we find naturally in our own bodies. So hyaluronic acid stimulates collagen. So it's going to improve the integrity and quality of your skin. It breaks down gradually and naturally over time due to your own intrinsic breakdown mechanisms and enzymes that we have. So as it breaks down, it's slow. It's not going to be a dramatic disappearance of filler. So it's never going to just deflate your skin. Secondly, we're not putting in large quantities. We're not putting golf ball size, fillers. We're putting such small amounts. If you looked at what it looked, 1 ml or 2 ml looked like on a teaspoon, I mean, it's nothing. And it's about placing small amounts in strategic areas. It's not about placing tons of it in one area. I think where this probably comes from is, back in the 80s and early 90s, there was a big craze in using more permanent silicone-based implants. So, people would get big cheek implants. So once they're taken out, then obviously that area will deflate because it's just been pushed out, and obviously the skin will, adapt and grow over. So I think maybe that's where the misconception comes from, but no, it doesn't. Simple answer.
And also I think the important thing is when you're restoring fat loss in an area, it's very different to creating more volume in the area that never had it in the first place.
Yeah.
So actually, if anything, you're almost like smoothing out the skin in that area. So I know when I do it under my eyes, any wrinkles do tend to smooth out just because you're just refilling. Fat used to be there before, and then you lose fat as you age and volume as you age, and just replacing it. So I think that's very different.
Yeah, and it's interesting because it's just recently that we've even found that there's certain areas where we've got lots of different fat pads on our face, and there are some particular ones that actually grow with age, and there's some that get smaller. So you know, if you're going to go somewhere and they're injecting the area that grows in fat over as you age with more filler because that's what they think they need to do, it's just going to make matters worse. So you've got to really keep up to date at all times with the advancements in, you know, just understanding anatomy.
So where would that happen? Which areas of the face grow with age?
So so the areas that grow with age in terms of bone is our nose and our ears. So we're going to get bigger noses and bigger ears. But for fat in our face, it's mainly our nasolabial fold area and our jowl area that grows with age. So that's why people start noticing more jowls. But then that's highlighted even more when you're losing bone. So you've got so much going on. They like to call it more as a redistribution of fat and bone resorption or skeletal resorption as we get older. So it's complex, but you've got to be able to understand it and look at it and know exactly what to do and where to place.
Is it a mistake then to fill the nasolabial fold? Is this a mistake if it's going to grow anyway?
So that's probably the area that I will inject last. So after you've lifted, from what we were talking about before, in the mid-cheek area, even some of the lateral cheek area, maybe even an area called our submalar region. So you want to basically try and max out everywhere else before you inject in this area. Also because it is a dangerous area to inject too. So after the nose, this area has the most cases of associated vascular occlusion or blindness.
Is there a reason for that?
Again, anatomy, the way the artery sits and how it's connected to the back of the eye. I'm trying not to get too nitty-gritty.
No, I like it. I'm loving it. Okay, so the next one. Is this safe to do during pregnancy?
So, we never do it if someone's pregnant. It's funny though, we once had a patient who said that she wasn't pregnant. She signed, said she's not pregnant. She didn't look pregnant. We did her fillers, and at the end she was really happy and she was like, "Hi, I'm actually pregnant." And I nearly died. I was like, "What?" And she was like, "Yeah, I'm 4 months pregnant or something." And you know, I had a bit of a go at her. Obviously she had signed and she said to me she's not, so there's no way of me knowing. We don't do pregnancy tests on everyone that comes through the door. Anyway, so you know, it's phenomenal what people will sometimes do for fillers. But
during COVID, like how many people were trying to get to you?
And then when they did come, they'd been elsewhere, and we had to do you know, the amount of dissolving we did in July. It was crazy. For sure. But the short answer is, you shouldn't get fillers when you're pregnant because there are no studies. How can there be studies? There are some studies in mice for Botox, but we'll talk about that in our Botox video. But for fillers, there are no studies because it just wouldn't be ethical to trial that. So it's just one of those things where you know there's no evidence for it, there's no data, there's just nothing. So you just leave it.
Just avoid. Okay. I think a really important question is it always obvious that you've had work done?
So the simple answer to that will be, if anyone can tell that you've had work done, then it's no good. So no one should be able to know that you've had any sort of work done, because there's two main types of treatment. So the first type is rejuvenating and maintenance treatments. So that's what we were talking about before, where you're just trying to keep up with aging, essentially. So you're doing small tweaks in areas where there is aging to just restore, replenish, maintain. So that's very different to if someone comes in for the other type of treatment, which is subtle enhancements. And that will be your things like cheek contour, straightening your nose bridge, lifting the tip, lifting the brow slightly, contouring the chin or jawline. So they're slightly different treatments. And even with those, you should always do it in a subtle way where you're not trying to dramatically change anything. Because you want it to remain as natural looking as possible. I think there are a lot of places out there where, you know, they do promote the absolute crazy, you know, crazy look. And I think what you want to really focus on and you want to bring the world back to is, you know, just the subtlety of, you know, just looking natural. Like even Kylie Jenner, she first went for huge lips, then she dissolved them all because she was like, oh, it looks really weird. And then, you know, now she's slowly getting a little bit back here and there. But I think, you know, you don't want to ever do anything that is so dramatic that you're then needing to go down the dissolving route as well. So that's the main difference.
Slowly.
Exactly.
Do you feel like people become addicted to
100%, and I think I think when they come in, that's where you as a doctor have to really understand what's going on. We try and do really, thorough psychological assessments on our patients to understand exactly why they want treatment, and if the answer to that is, because my agent told me that I need a better nose, or, if it's any other reason other than, oh no, it's for myself, then, we probably won't do the treatment.
Yeah.
Most probably won't do the treatment, for sure. I think it's up to the doctor to say no. We spend a lot of our time in clinic saying no.
Do people get offended or upset?
Yes, they do. And we've lost a few patients by, us saying no to certain treatments. But I think in the long run, they do, we've had some that have then come back, they ventured elsewhere, and then they've come back and they were like, I really appreciate that you were very honest with me.
Yeah, no, I completely understand. Okay, so the other question I want to ask is, does it matter which brand of filler that you use?
Absolutely. There are over 150 different brands in the UK.
Wow.
95, maybe even 99% of them are absolute garbage. They don't have the medical research behind them. They don't have any evidence base, any clinical studies. You don't know where they've come from, what their sort of storage conditions have been as they've been transported. They come from all over the world. You don't know where they've been, how they've been designed. I've emailed some to ask about the composition of their fillers, how they're cross-linked, what they've used, what added ingredients have they, and I don't get a response. And if you don't get a response, you know that they're hiding something, or they just don't want you to know. I'm not going to try and make fillers, but the brands that will tell you absolutely everything and are transparent with you, that they're much better. Also, like I said, you can buy fillers from eBay. You can buy fillers from, you don't have to be a doctor to get them. Anyone can get them. So you need to go somewhere where you know that they've got the fillers from a registered medical pharmacy, because they go under very strict regulations, and from the factory to the pharmacy, there is a very strict transport set of rules, and that it's going to be good quality stuff that you then get, and it's all traced back. So they've got specific lot numbers, they've got specific data associated with each batch that if anything ever went wrong, there's a whole backlog of areas that you can look into as to why it did, and it doesn't, because it's just so rigorous. It's very important to get the filler that is going to last a longer time, because the more injections you get, the more risk you're putting yourself under for infection, etc. So you don't want to be coming every 3 months to be getting your fillers done. And you want to get one that is very is good at keeping up to date with the latest in the compositions of fillers as well, because there's some that look very static on your skin. So when you're smiling, eating, chewing, everyday life, opening your mouth, closing your mouth, you don't want fillers to look like they're just stuck on. You want them to integrate with your skin. You want them to just feel soft and just part of you, as opposed to, oh my god, there's something hard anywhere. And you want fillers to have a degree of stretchability and a degree of dynamism, because our faces aren't static. We're constantly moving. Even when we're sleeping, our eyes are moving. So you want something that is going to be able to handle that.
So which are your top 3, would you say?
So I'd say my top 2 would be. So my top 2 is my favourite is Teoxane. I just think they have a very huge emphasis on making sure the filler is very safe. They have a huge emphasis on making sure that the filler is always up to date with the latest evidence for how fillers should be. And they're the ones that really hone in on the filler having a degree of stretchability, especially for places like your lip or your jaw, for example. If you've got filler in your lip, you can sometimes tell. Even you don't even have to be anyone that's within aesthetics to know. You could be anyone, you could see that they've got something in their lip if it doesn't move with the lip. Do you know what I mean? So I really love them for that reason, and I've been using them for years and I've never had any issues.
Okay, amazing. And what was the other one? That was
Juvederm I really like too, but there's certain ones that I like and certain ones that I don't like as much. But they've been a brand that have been around for a very, very long time.
Okay.
So they've got a lot of history and historical experiential evidence attached to their fillers too.
Super. Then the other question we get asked, the most important question of everything, is does it hurt?
I know you're always worried about that.
I'm so pathetic. I'm not even going to lie. I'm the biggest baby going. I can't even, honestly, like, I've had 2 C-sections and I still, you know, if I get my filler done, I'm like crying. I'm like asking for my mum. I'm praying to God. Like, I'm so pathetic. I've like squeezed Sanjay's hand over there. Like, I'm like literally.
And afterwards, I feel like you've had the worst time, and then afterwards you're just like, it wasn't that bad. And then she's like, okay, when am I back again?
It's because I'm pathetic.
But I think it's the anxiety of getting it done too. And I think what I find is a lot of patients, once, you know, a lot of the times they're a new person getting their treatments done for the first time. Like, for example, their under eyes, they're so anxious because they just don't want to look like, you know, someone that's been on the front cover of Daily Mail. You know, everyone's so anxious about it. So I think the anxiety is also plays a big part in, you know, how much pain they perceive. And then once one side is done, I always show them, and then when it looks fine, the other side is like a breeze. You know, they're just so calm. I think that's what I would really, you know, advise people. If you're ever getting treatment done, just try and be really calm, be confident in your practitioner, and, you know, just try and relax, and it will make it a lot easier process. But yes, we do apply some numbing cream.
Which one do you use?
We use LMX 4%.
Yeah, so I make sure she really slathers that thing on.
We once had a patient who stole our LMX cream. Yeah, so the next time when she came, we caught her in the waiting room, like full on her face, and we were just like, and I think she was only getting a small area. And she was like, yeah, sorry, I stole it because I just wanted it on for like the whole day. Like, I don't even know how she managed to do that.
Oh my goodness.
But anyway, so LMX, sometimes you can use a bit of ice to numb the area, and the fillers themselves have local anesthetic inside them.
Yeah, no, it does feel very strange. Like, I remember when I do it here, you can actually feel like, you can feel it, the needle on the bone.
Yes.
And it feels like a crunching sound, and you think it's just such a different experience, and so that's also like is a bit scary. And also the second time you just think, actually, that's normal.
I think if the practitioner just constantly explaining to you what's going on, then you know, and it's completely normal because it's so close to your ear. When you're on the bone conducts sound really well, so you hear it a bit more. So I think it's just about pre-warning and anticipating what the patient might feel. And
you do that really well. Really? You'll say, this one's going to be really painful now. I'm just kidding.
But yeah, no, it's one of those things where I've never had anyone that has said they can't do it because of the pain. It's always manageable. And there are some areas that are slightly more painful, like for example the lip, I would say, is a painful area to treat. But most other areas, I would say, they're completely fine. Especially with the use of cannulas. Cannulas, you know, travel in a layer of your skin with no pain fibers. So other than feeling a little bit strange, it doesn't feel painful. And the treatments don't take very long. The treatments, you know, take 5 to 10 minutes. So it's not like it's a long time.
No, absolutely. I remember I got my Selfina done, and that was literally probably the most painful experience of my life. The nicest doctor ever, but honestly, I think I cried the whole time. Again, such a baby. It's probably, the treatment was fine, it was me. I'm pathetic.
I'm pathetic too. When Sanjay does anything for me, I'm just like, I'm just like constantly just watching the mirror, and I'm like, ow, that really hurts.
You look in the mirror, oh my goodness.
I'm such a micromanager.
Really? Oh my goodness.
With that, for sure. I wish I could just like morph out of my body and do it for myself.
You can't.
No. Sanjay's good though.
Thank you so much, Dr. Zoya, for joining us. She's been amazing. We're going to do another video for you on Botox. So make sure you watch that video if you're thinking about getting it done. Thank you very much for watching. Don't forget to download your free guide. Link is down below, and I'll also link all of Dr. Zoya, Trick One, and Sanjay's social medias down below as well. Thank you very much for watching.